utilizing peptides, utilizing different medications, utilizing different strategies aside from just eat less and exercise more, I believe is necessary. And this is why you've heard me say in past episodes, I actually think when that first 10 or 15 pounds comes on, it often comes on for us in menopause because of our shift in hormones. That's the time to intervene. It's crucial. And the obesity researchers will probably agree with me on this. Not gaining the weight is critical. Why are we reserving these peptides for folks who are significantly overweight or significantly on their way to type 2 or already in type 2 diabetes, I should say, for them to qualify for insurance coverage, right? And again, I think the brand name ones are starting doses too high, but I've talked about that in past episodes. What I really want to get at here is don't gain the weight in the first place. That's critical. So if you're suddenly 15 pounds up, 20 pounds up, because you're, my age or 50, and you're like, what the hell is going on? That's the time where I think a very low dose, along with a comprehensive program, including looking at hormones and everything else, is critical to success because we don't want that set point to go up. I've already had my set point go up. I stayed too long with that extra 15 pounds on, and it wants to stay there. And so now that I've been using microdosing GLP-1s for a few months now, and I've talked about it I did a whole episode about it. You guys can go back and listen. I was using it not for weight loss specifically. I was using it because I could tell something in my brain had shifted. I could feel it. It was like a switch had been flipped, like a circuit breaker that had blown, and it needed to get reset. And I was struggling with some autoimmune issues, and I was struggling with brain fog, and I was feeling really out of sorts. And I knew something had to give, and hormonal replacement wasn't doing it. None of my other strategies, and I have access to the coolest stuff, you guys. It just wasn't working. And so I started utilizing a tiny, tiny dose of GLP-1s and having really phenomenal success. And so you guys can go back and listen to that episode where I go into that in more detail. The point being is every single patient that I have on this at microdoses, nobody is getting any adverse side effects. Nobody is feeling ill. Most aren't even at starting dose, or if they are, that's where they're staying. And I think one of them specifically is the only one I put on it for weight loss, and because he has type 2 diabetes and he's morbidly obese. Everybody else was for different reasons, independent of weight loss. So these peptides have a lot of different impacts on different body systems, and I covered that in detail on other podcasts. So please go back and listen to them before you jump all over me, because there are a variety of features here. One of them being they sit on our macrophages. They actually impact our immune system because our immune system cells, our white blood cells, some of them have GLP-1 receptors. So all that to say, intervening early, and this whole culture we've built where it's like, well, maybe your body isn't supposed to be the same size it was. Yes, actually, you're not supposed to be 40 pounds heavier in middle age. Now, there is some fat that's protective. That's because of leptin and other, adiponectin. There's other hormones that are secreted by healthy fat, but most people's fat over time becomes unhealthy. It gets a bit overcrowded and it becomes inflamed. And once that happens, all systems go bonkers and it's a mess, and you end up with visceral fat being laid down. And like the second you start adding visceral fat to your body, your fat is not healthy. For me, that's when I get over 5 or 6 pounds extra. Suddenly, it's all visceral fat. So there is no healthy subcutaneous fat that I get. It's not really in my cards. I'm not built that way. I'm built like a little apple. And so any weight that I get goes right into my visceral fat, which is the fat under the muscle layer in the stomach that surrounds the organs. That's very inflammatory and it's very bad. And it leads to insulin resistance and type 2 diabetes. And I've seen what it does to my family members. So all of this to say, looking at this comprehensively so that folks can have success is the key. And the other important part here is leptin resistance. There's a lot of talk about leptin resistance, and I absolutely believe in that. You've heard me talk about it in the past. Leptin resistance is really interesting because the fat's there, it's secreting the leptin as it would, yet our brain cells have been so flooded with it that the receptors start cleaving off, much like insulin resistance or the resistance of any hormone that is too high in the body. Leptin resistance is a real problem. How do you correct leptin resistance? Well, there are concerted strategies, but basically, in a nutshell, it's all the things I preach. It's all the things I've been telling you to do. Go outside and get light in your eyes during the day. Don't stay on your phone all night and be a night, total night owl. That vampire syndrome that some of us, me, suffer from probably put me into this mess, right? Exercise is critical, but not over exercising. We don't want to blow the circuits out. It's absolutely critical that you strength train more than anything. Strength training and walking, I think, are beautiful, beautiful harmonizing therapies to help folks combat visceral fat, combat leptin resistance, combat all of the bad things that can happen as we age and become more inflamed. We're just becoming more inflamed and more carbohydrate intolerant as we age. It's just the way it is. That's the way our bodies are built. So we might as well accept it and get strategic about it. We want to make sure our hormones are balanced as best we can. And I know that's kind of a misnomer of a term, but making sure we have adequate thyroid on board, making sure as our estrogen's decreasing that we're looking at potentially supplementing that with BHRT. Progesterone's a big one. I think all of these sort of dance together, if you will, if you think of it like a jazz band. You can't have any one instrument missing or it doesn't sound right. Leptin lowering or leptin because of weight loss or leptin receptor resistance will definitely contribute to thyroid hormone going off kilter. So all of these things are tied together intimately and really, really important. Our gut health is important. Our toxicity level is important. Understanding how to run our own labs and look at them and critique them on our own without having a doctor on board. I mean, of course, you always want to have your doctor look at your labs to make sure you're not missing something, but being able to really just look at your labs and see just with some simple markers, like where's my inflammation at? Where's my blood sugar handling at? That's really critical. These are all things I'm going to be addressing in detail inside of my program that I'm about to release. Our stress response, our mindset around it, all of these things matter. And it's not as simple as doing a laundry list of tasks and getting your red light in and all of that to make it all go away. This is a comprehensive problem that requires a comprehensive solution, and it's not cranking GLP-1 agonists. It's not cranking Ozempic. It's not putting Ozempic in the water and giving everybody Ozempic, but it certainly isn't pulling Ozempic off the market because it's so dangerous. We're blaming the peptide for the dose. The poison is in the dose. And the doctors are going with what the data says, and the data has people cranking the dose. And I honestly think most people are being overdosed and it's causing them a lot of terrible side effects. And the peptide's getting blamed for what the dose is doing. There are some folks who will not be able to take these, or they won't be able to take a certain one and they need to try a different one. There's a whole host of GLP-1 receptor agonists. So we have to stop blaming the peptide and calling Ozempic evil as this blanket statement when it has its place. It does play in concert with all of these other things I mentioned really beautifully. It is deficient in a lot of people. Now, if we get them back online, and we get their health improved overall, will their GLP-1 production naturally ramp up? I hope so. That would be nice. But for those who it doesn't, some of these folks might be on these forever. Some of these folks might lose so much weight that their leptin decreases so much, and they're already dealing with leptin resistance, that the only way to override that insatiable hunger that is going to be increased with the weight loss is to potentially keep them on this peptide for long term. And I'll tell you what, if it's going to decrease, we know it decreases cardiovascular disease, it improves kidney function, all of these things that are side effects of poor metabolic health and diabetes, and, running around with 40, 50, 100 extra pounds of pro-inflammatory fat on our bodies, we need to ask people about their risk tolerance. And I sure can tell you that there are folks that would much rather have their life and be able to move freely and not be in chronic pain and not be worried about dropping dead of a heart attack and not, having their kidneys go south on them and not mind maybe a little bit of nausea or potentially some loose stools, right? And if you dose this stuff right, those are not so much of a problem. That is what I'm finding clinically and what I'm finding from so many pharmacists and doctors that I've talked to who are using these, who really are in agreement with me that just short of a miracle in many cases for people. So with that, I will bid you adieu. I hope this is helpful for your understanding. If you have been on the weight loss journey and it's been really frustrating for you, hopefully this sheds some light on. This is kind of the kindergarten version. I go into the, high school version and college version inside my program. There's a lot of other hormones to talk about, but just know that leptin resistance, decreased leptin, and then subsequently a whole host of other hormonal changes and neuroendocrine changes are happening at the central level and the peripheral level when someone loses weight that really stack the odds against them to regain that weight. The body, the fat talks. The fat talks to itself and it will protect itself at all costs. And I'm a big fan of utilizing whatever tools necessary to get people the results that they need, not taking them into super skinny mini land, because there's a whole host of dangers that come along with being underweight that I will talk about at a later date. And I definitely am going to talk about inside my program. But getting people back to their fighting weight where they can move freely, they can really ramp up the movement and the exercise and the strength training, which is critical. Like that part's non-negotiable, guys. It's really non-negotiable. Please, if that's all you take home from this, strength training, whether you're taking peptides or not, is non-negotiable if you want to age well and you want to have good health. You have to have muscle going into this.